I'm Huw Thomas, and I'm a partner at Carey Olsen in Jersey. I practice across a range of fields, including employment law and data protection and privacy, and what my partners like to call weird stuff. This is our podcast, People, Behaviour and Governance, which is a podcast about organisations, the people who work in them, and how they behave. Today, we're joined by Chris Edmond, who's an occupational health practitioner who runs a local business called WorkHealth. One of the areas that a lot of our clients find very difficult is supporting colleagues with health challenges, particularly mental health challenges, and colleagues who may be neuroatypical to some degree. That's not necessarily often not because employers don't want to help or don't want to support colleagues in those particular situations. It's more a question of not having the expertise in-house and not knowing where to access help and support outside of their organisations. So welcome, Chris.
Thank you, Huw.
You're the medical director of WorkHealth. What's WorkHealth?
WorkHealth is the Channel Islands' still only occupational health provider, so dedicated provider. So we are a practice of medical professionals, and we specialise in the interrelationship between work and health.
Right. So the Channel Islands only offering. So for sort of most employers, if they don't use you, they've got to go to the UK? Or? Mainly
the UK. There are some local GP practices who provide a little bit of occupational health support, but we're the only dedicated provider.
What brought you to sort of occupational health as a...
It's an interesting journey, I guess. I started off primarily my career as an A&E doctor. Yep. So I used to see sort of work-related injuries, and that sort of piqued my interest in work-related factors. I then did some work for the Social Security Department in Jersey doing benefits assessments. And a lot of the people that we see on a regular basis are people who've essentially been damaged by their work. So we used to see people whose careers had come to an end due to work-related trauma, work-related physical injuries sometimes, but often sort of the end result of stress and bullying and other similar factors in the workplace that meant that they had to leave their work. So they would come to us for assessments for their incapacity benefits. So that then sort of developed my interest in that relationship between work and health and the impact that work was having on people's health. What struck me is that I'd started my career sort of in the healthcare field, working on a mental health helpline, so dealing with people who are actively suicidal, for example. But what I saw in people who were damaged by their work was it was equally, if not more, traumatizing than any other form of trauma that we see in people's lives. And I wanted to do something about it. I wanted to see how we can address those factors that affect people's health in the workplace.
And that probably explains why you think it's such an important service in terms of its availability to employers.
Absolutely.
What's the awareness of that kind of service like for employers? Do they know where it is? Do they know how to use occupational health practitioners?
I think it's growing at the moment. So we set up 4.5 years ago, approximately. Partly triggered by the pandemic, which raised the profile of the need for occupational health. So during the pandemic in Jersey, I ended up being the clinical lead for PPE for the government. So we were distributing PPE across the island to all the businesses. And I think that made people realise that workplaces were a place that could be good for people's health and equally damage people's health. So we were supplying all of this new protective equipment. I at that point, I'd already recognised that there was a gap in the market, that Jersey and Guernsey absolutely needed an occupational health provision. But the awareness is slowly building. I think most people don't realise that we are a medical specialty. It is a recognised medical specialty that specialises in that link between work and health. And what we tend to be is sort of almost a translation service. So what we understand uniquely is both the workplace factors and the health factors. So in some ways, we're a translation service between the two. So if you're an employer and traditionally you've gone straight to the GP for a medical report or the specialist, well, number one, you probably shouldn't be having all of that confidential health data because you don't need the majority of it. But number two, you might not understand it and might not know how to act on it. So we sort of sit as an advisor in the middle, being able to translate the medical information, translate what's happening to the individual, and provide sensible, appropriate, tailored medical advice or workplace advice for the employer about how to handle tricky medical situations.
And does that differ sort of fundamentally from, say, the work of a GP?
Absolutely. What we are is completely independent. So we sit between the two. GP's first priority is always going to be their patient, rightly so. And I think a lot of the time, people or GPs almost see employers potentially as the enemy, potentially as the cause of the problem. What you need as an employer is somebody independent who can interpret that medical advice, also to some extent interpret the law and the responsibilities the employer has, and then translate that into sensible advice for you as an employer that is completely independent, that is defensible in a tribunal if it gets to that point.
And what kind of issues do you normally get involved in? What's the sort of meat and drink of your...
So our business is essentially split into two. One is dealing with people in safety critical roles, so making sure people are safe to do their work. So if you're operating a crane or driving a bus, you've got to make sure you're not going to collapse. So we do an awful lot of that sort of work for the construction industry and similar. On the other side is people who have health problems. Now, it's probably split 50-50 between physical health issues and mental health issues. We see lots of people with the challenges around cancer and staying in work and getting back into work. We see people with typical injuries. So used to be a lot of back pain. We still see plenty of that. People with broken legs, people who've had football injuries, and how do you get them back into work? But increasingly so, we see more and more mental health issues and issues around neurodiversity, as you said in the introduction.
And is that because there's more of those about, or is it awareness is growing, or is it all of the above?
I think it's all of the above. I mean, there was an interesting article in the Times today about young people off work. So in the UK, 1.2 million young people between, I think it's 16 and 24, are currently out of work. And 2/3 of them aren't looking for work because of health issues. Now, that's shot up hugely in the last few years. Part of that is probably the sort of tail end of the pandemic and the effects that that's had. I think part of it is we are seeing a growing mental health crisis, particularly in the young, and particularly as they're now sort of entering the workplace and finding their feet.
And what's driving that? Do we know? Or is it?
Again, probably part of it is the pandemic. You've got to think we're talking about the generation whose schooling was interrupted, their university lives were interrupted, life was changed hugely over the last few years. Yeah. We've also had a cost of living crisis. The world, I think, is far more unstable, perhaps more so after last week and events in America. But we are living in an uncertain world. And with the availability of 24-hour news, there's a constant sort of stream of that into people's world. Social media certainly has an impact on that because we now have this ongoing feed, often of a lot of negativity, certainly a lot of polarization. And I think that's a really hard world to live in. The world was simpler when we were at school, I think.
Yes. I think the difficulty with that, though, for employers is that what you've described is a lot of non-workplace related sort of things that lead to mental health issues. So it's a sort of possibly timely reminder that not everything's about work. The unfortunate thing for a lot of employers is that the impact of those are felt in the workplace. And that's sort of certainly something that we get quite a lot from clients, that you can't solve every problem. There's only so much you can do. Which really brings me on to other things that occupational health practitioners can't do.
We can't solve everything. What we can be there for is a sort of independent listening ear. A lot of our work is signposting. It's always amazing when people get as far to us, so they'll have had issues at work, they'll have had a period off sick, for example, but they won't be aware of the services that are available to support them. So a lot of our work is simply signposting to existing services. A lot of people who have private medical insurance through their work aren't aware of it and won't use it. There'll be employee assistance programs that they're not aware of and haven't used. So a lot of it is just that initial, where should you be going for support and helping at that stage. We can identify workplace issues because, as you said, a lot of things are not work related, but the employer has the responsibility for the workplace side of things. We do see, I think, again, as part of the reflection on society as a whole, businesses are under pressure. They're facing the same cost of living challenges that everyone else is. We're all facing productivity challenges, wage growth. Life has been difficult for the last few years for businesses equally. But a lot of that's been passed on in terms of additional stress to employees. We're expecting more, I think, probably out of our employees in terms of their productivity. If that's not managed appropriately and it leads to far too much stress, then that can lead to tipping over to actually contributing to the mental health difficulties. So what we can do is try and tease out which part of the problem is personal related, which part of the problem is work related, and offer support on both sides.
Most of us work in offices now, or sort of manual labour environments. Has mental health become the biggest risk to employees' health in those sort of office environments, do you think?
It has, I think, absolutely. I think equally we kind of put the manual workers to one side, but they are equally susceptible to mental health difficulties. And when we're looking at how we address these things, we shouldn't forget them either. I think the modern office environment is probably more challenging. I think open plan offices are difficult for lots of people. Hybrid working has been a fantastic introduction for some, but it's caused changes in the nature of the relationship between employees and their colleagues and their managers. And I think, again, the workplace has become more complex because of that. It used to be, so for example, I started off in banking. I worked for Barclays Bank at the start of my career, and I worked up in their centre up in Cheshire, and we had an on-site social club, and there was a football team, and there was a bar. Unfortunately, the bar had shut by the time I started there in 2001. But that was the nature of work back then. It had a social element to it. It brought people together. We've lost a lot of that in the modern workplace. We've lost a lot of that sort of humanity.
The connection stuff.
The connection. Yeah. And you often see, you walk past the big office blocks, and it does look a little bit like lots of rats in their cages, sat at their desks, typing away. And there's something about how we've dehumanized the workplace.
And have you seen that sort of follow on into sort of mental health issues, do you think? Is there a traceable sort of rise in mental health issues as a result?
Absolutely. We know that there's plenty of evidence in the medical literature and the occupational health literature. Open plan office working is bad for us. And a lot of the behaviours it drives is bad for us. And the lack of social connection that people are getting, it's now recognised that a lack of social connection is as damaging to your health as smoking is. Yes, and I'm not saying that the employer has all the responsibility to give people a social life, but it used to be somewhere that was a core part of people's lives, and I think there is something about how we look to reintroduce that.
And I suppose hybrid working, which you mentioned, can be a contributor to that as well, because people end up quite isolated at home. And yeah.
I think it's been a fantastic benefit to some, and I think the flexibility it's given has been great. I think, again, probably one area where occupational health is useful is having those conversations on an individual basis about what suits that individual. Part of that needs additional flexibility on the sides of the employer. We've seen a lot of shift back after the pandemic from full-time home working to a lot of businesses, largest businesses in the world, trying to get people back into the office. We've seen it with Amazon and Apple and similar. And that's happening in Jersey and Guernsey and the same as anywhere else. I think what we're losing again is that sort of individuality, the flexibility, the what suits the individual, because some people love working at home on their own, not seeing a soul all day long. That suits them. That's their personality. Some people, the working from home during the pandemic caused significant psychological damage to them, and that isolation. So it's how do you tailor your policies and procedures and solutions to get the best out of everyone?
Yeah. Of course, a lot of smaller employers would make the point that flexibility requires a managerial bandwidth, which a lot of the time they simply don't have. And that's a challenge that we get as employment lawyers quite a bit. That actually, one person, for instance, with a mental health issue is fine in a workplace. That's manageable. You can respond to their needs and that sort of thing. You get to 2 or 3, and all of a sudden it becomes a managerial issue. Yeah. Which takes up an awful lot of bandwidth. I'm not sure there is a right answer to any of that, but it's...
I'm not sure there is. I mean, obviously I would advocate people involving occupational health at the earliest stage, but I'm a small business owner myself. I know the challenges of employing people and juggling those issues. And it is hard, but I think if you can keep the longer term in mind, if you keep your employees happy and healthy, they're going to be far more productive. They're going to stay with you. You're going to have less in the way of costs to recruit replacements down the line. And you're going to have people that want to give back to you in the longer term. So I think where we've seen businesses sort of get through that stage and grow and be able to offer that flexibility, what they get is very loyal, very productive employees. So it's, can you get over that difficult stage, I think is the challenge.
So in terms of the law in the Channel Islands, we've obviously had disability discrimination in Jersey since 2018, I think, and in Guernsey since October last year, 23. Do you think we get our approach to that sort of thing right in the Channel Islands? Is that... Because obviously we've transposed an awful lot from the UK in terms of reasonable adjustments and things like that. It's not identical, but it's very similar.
It's very similar, but obviously, as you know, we took a far broader approach and a far looser definition of what constitutes a disability. And Guernsey went even further than Jersey. So in Guernsey, any condition with the potential to cause an impairment lasting longer than 6 months can qualify as a disability. Is that a useful concept? I think it probably is in terms of trying to change behaviours and trying to change culture and getting people to understand the individuality of everybody.
Yes.
But I think it's a fairly blunt tool to do what is quite a subtle task over time. A lot of our work is that subtlety of picking out what's actually reasonable for this individual, what's reasonable for the business, or what's likely to be reasonable for the business.
Yeah.
I think we needed discrimination legislation on the island. I think it has changed employer practices for the better.
Yes.
I think partly we probably haven't seen the volume of cases go through our tribunals because of the cost of doing so and the potential reward of doing so in Jersey.
It'd be quite interesting to see what changes as a result of compensation changes that are coming down the line in Jersey.
But I think that's made it hard to set a baseline of where sort of the tribunal actually see the standards being. And what I would like to see is a fairly common sense approach. I think we've set fairly broad legislation, which is a good thing overall, but so long as the tribunal then take a sensible approach of the definition of reasonable. Yeah. And obviously that depends on the circumstances.
And it would be nice to get some sort of case law again, some local case law on that.
Yeah.
Do you think employers understand the law? It's a complex beast in both islands, isn't it?
It's a complex beast, and I think there's a lot of fear about it, quite understandably. There's a fear of the tribunal. We see quite a few cases that get referred for occupational health assessment that are purely management issues.
Yeah.
If your employee isn't turning up to work, if your employee has committed some act of gross misconduct, that's not really an occupational health issue the vast majority of the time, whether they have a disability or not. So I think there's a slight defensiveness there at the moment in terms of employers and their management of it.
It's knowing when to engage people, services like yours, I suppose, exactly. Which is the trick. I mean, of course, some of those areas which employers find most challenging relate to mental health and neurodiversity and mental ill health. Does that sort of chime with your experience? A lot of employers seem to be better at physical ill health than they are at mental ill health, for example.
Yes, and absolutely. I think physical ill health tends to be more understandable. You can normally see it. Employers tend to have more of a sort of experience of it. Not that it's always well managed, but I think it's simpler. I think the mental health issues that we're seeing, because of the degree of complexity, because it's never very rarely a simple work-related issue or a home-related issue. It's trying to unpick where the employer's responsibility is. And although I'm a passionate advocate of sort of healthy workplaces and a passionate advocate of employers taking a caring approach to their employees, they are only their employer. They're not.
They can't solve everything.
They can't solve everything. They're not responsible for what goes on in everyone's lives, and they're not responsible for fixing it. And it is trying to pull out and tease out those issues, and that's really hard for employers to do. And I think the expectations on them these days are huge. And that's why having a professional occupational health service, I think, is really useful for a lot of employers.
Yeah, I mean, that's one of the things I was going to ask you. Do we ask too much of employers?
I think employers, because of the culture of awareness that we've seen, there's an awareness day for everything. The employers have.
Isn't it? I think it's World Kindness Day today.
So employers suddenly have a responsibility to create awareness and training seemingly for every medical condition under the sun. I don't think that's particularly fair on them, and I actually don't think it's particularly useful. An employer should be focusing primarily on creating a healthy, happy workplace. That's not done typically through awareness days. It's not even typically done through mental health first aid. It's done through having managers who are trained in having good conversations with their people. It's actually a lot to do with the hygiene factors in work. It's about having a good workplace, but more importantly, it's working for an employer that has a vision, that seems to be going somewhere, that inspires you. It's far better for your health and well-being to work for a company that you believe in than one that provides all sorts of health education days. It's about making sure that your values are aligned with those of your employer. It's about feeling you're part of a team. It's about that social element of work. It's about going to work and coming home feeling that you've made a difference. That's what makes a difference to people's health in the workplace, as well as cutting out the things like bullying and harassment that, of course, shouldn't be there.
The classic stressors, because, we do talk a lot about well-being in the workplace without really ever defining what that means. It's the great sort of amorphous, we'll look after you type thing. What are the biggest barriers to sort of well-being in the workplace, do you think? It's a big question.
I think, as you've just said, defining it is a barrier in the first place. Figuring out how to measure it, figuring out what the employer's responsibility is. And I do think we've probably gone too far, if I'm being honest, in that direction.
Do we talk enough about employees' responsibility for their own health and well-being?
I think more and more so we do. More and more so we are encouraging employees to look after their own health and well-being. And I think that's something that the health service actually has more of a responsibility to do rather than employers. I think as doctors, nurses, we should be encouraging people in terms of healthy behaviour and supporting them. I think that's less of an employer responsibility. Yeah. I think
is that understood?
No. Not particularly. I think there's a movement to change over time. I think there's locally I work with a lot of organisations that are trying to make that change in the health service. Yeah. But in terms of the employer's responsibility for well-being, the employer's responsibility is making sure that people are paid enough. And making sure that people take their holiday leave, and it's possible that people aren't overworked. It's the employment factors that the employers should be focusing on. You see lots of measures of well-being in the workplace, but I think probably we don't focus enough on those employment factors. I think that the HSE in the UK and their management standards on stress in the workplace is a really useful model because it highlights the things that the employer actually has responsibility for.
Yeah, they've certainly stood the test of time, those management standards. It is interesting to me that there seems to be this shift to sort of medicalise every issue that sort of employees have. And I was reading The Economist this week that up to 4% of the population in the UK is thought to have some form of ADHD, which is an extraordinary number. I mean, that's millions of people potentially. And if you transpose that to the Channel Islands, that's a lot of people. Do you think that reflects a rise in ADHD, or is it simply a greater readiness to diagnose?
I think it's primarily a greater readiness to diagnose. I think that there may be something about shorter attention spans and the rise of social media in recent years that certainly made it more evident, whereas perhaps it was less evident in the past. However, I think you've got to go back to the question of, well, what's the purpose of the diagnosis? I think in ADHD, in those people that are likely to benefit from medication, who are at the more severe end of the spectrum, then it's a useful diagnosis to have. But I don't think there's any evidence for organically they're being more ADHD than they used to. So it's the same with autism. There's no evidence that actually the rates are going up, but our diagnostic threshold has changed, the way we diagnose these things changed, and the number of people presenting for assessment has changed. That's probably a good thing in terms of people are understanding the way that their minds work, and that can be useful in terms of their manager understanding the way that their minds work and potentially putting in place tools to support them. Is the label particularly useful? I think it can be for some people. I think overall, we're far better looking at individualising the support that we're getting. I go back to the fact that we're all different. We all have some form of diversity in the way that we think. And it's those skills that we need to create in our managers are those about how do you understand every person that works for you? How do you put in place the adjustments that every person needs rather than just the ones with the diagnostic label?
So recognising nuance.
And that's difficult, but I think that's where businesses really succeed, is when their managers are able to recognise those differences. How do you coach employees to be the best that they can be? And I think having that sort of coaching mindset, maximising people's abilities and their successes, rather than necessarily focusing on the deficits or what we would label a disorder. Because so often, some ADHD, the D stands for disorder, but so often it's not a disorder and it shouldn't be seen to be.
That's one of the interesting things about the Economist article, which suggested that we should stop treating it as a disorder and just recognise that there are differences in individuals, which is an interesting take.
And I think it's one that I would very much support. There are people who absolutely it has a significant impact on their life, and it would fit with the medical understanding of what a disorder is, and they need additional support because of that. But I think universally we have to move, and to be honest, this is the core of occupational health. It's about maximising people's capabilities, whether they've had a physical injury, they've got a long-term disability, mental health, whatever it is. It's about seeing their strengths rather than their weaknesses, figuring out what they can do rather than what they can't do, and sort of taking that coaching approach. And I think...
Do you suggest coaching as a sort of occupational health intervention?
Yeah.
That's quite unusual to hear that, and it's interesting that you recommend it. Do you think it's effective? Do you think it's?
I think it certainly can be, particularly with the right coach.
Yeah.
Again, it's about having people who can understand nuance and who can support people in the longer term, because a lot of you might go into a situation and you're going to see somebody who's got a label of ADHD, but their issue isn't about that. Their issue might be they're in the wrong career. Their issue might be stuff at home. So it's about having that nuance and understanding of people.
Yes.
But I think occupational health traditionally has been seen as a one-off assessment. So you come, you get your assessment, you get your reasonable adjustments, away you go. It's not really how humans work, and it's not how workplaces work. There's far more subtlety and far more variation. So I think over time we're going to see far more coaching approaches in occupational health. Yeah.
And would that be for the sort of employees being assessed, or their managers, or both? Or
both?
Yeah,
absolutely both.
That's an interesting one. Not something I've heard as a recommendation before from occupational health, but it's very interesting that you'd suggest it, and it makes sense because it's an obvious thing to consider. In terms of where we are. In terms of workplace health, have things got better? They got worse? Are we making progress?
I think the honest answer is overall they're getting worse. If you look at the statistics, not so much in Jersey, but UK and internationally. And
that goes back to the tail end of the pandemic, uncertainty, pressures on people.
And it was also, we were seeing the trend before the pandemic, but it certainly accelerated through the pandemic and out the other side. There are far more people off with long-term health problems than there used to be. We are looking at ways about how you address that, particularly in the UK at the moment. The government are fairly well focused on it. But it's how do you get employers to work with the health system, with individuals? And part of that is that culture change. It's about most people who are off sick would benefit from being in work if it's good work.
Because work is generally good for you.
We know that. So how do you create good work? How do you create healthy workplaces? How do you stop the issues that are damaging people in the workplace? But encourage people to do what they can do. And I think the flexibility in home working has helped with a lot of that. But we need to go a lot further. We need to change the culture so that work is, there's a phrase in occupational health, work as a health outcome. So our health system should be measuring getting people back into work as a measure of success. Yeah. And traditionally as healthcare professionals, we've been very poor at that. We kind of see work as something on the side and we'll fix your health problems. But actually, a successful health outcome is normally for someone of a working age population to be doing something that they want to be doing.
Because the cynical view from employers, of course, is that GPs will sign people off, at the drop of a hat.
Yeah.
And to an extent, that's understandable, that their primary duties to their patients. But of course, it rather begs the question as to whether there's a cultural change on the part of medical professionals as well.
100% is needed. And I think that sort of occupational health and coaching mindset needs to be spread far and wide through the health system. And that's something I work on a lot as well. And it's something that's happening in the UK as well. So it's how do you change those attitudes? There's an awful lot of additional sort of training and support needed. And you've got to remember, in Jersey and Guernsey, you go and see your GP, you pay for them, you expect something in return, and often that's a medical certificate. Yeah. There's a transactional nature to the relationship, but what we have to change is that mindset of actually it's going to be beneficial for people to stay in work, and how to facilitate that.
Quite a difficult message to give to a patient, I guess. And so all we need to do is change workplace culture and change the culture of medical professionals, and everything will be fine.
Absolutely. And that's what I spend my time doing.
That might need to be episode 2. So thank you very much for coming in.
Thank you.
Been really interesting. And I think it's fair to say, look, these are really complex issues, and the idea that there are simple solutions to any of them is probably ambitious. But there are things that every employer can do and employee can do to improve the well-being of workforces, and hopefully to improve sort of health and employment outcomes as a result. So if this is something that you're looking at as an organisation, please do get in touch. I would love to hear your views and your experiences. And if you've got any suggestions as to where we might go next with the podcast, do let us know. With that, we'll leave it there. Thanks very much, Chris.
Thank you.
Thanks.